Okay, so this is my digital presentation for EDF 4205. I've chosen to focus on food and nutrition, specifically on healthy eating. So why is food and nutrition education so important? We eat food every day. We need it to survive. Our bodies depend on the food that we put into it. So why are so many people still eating food that is fatty, high in sugars, and overall just not good for us? Let's take a look at the statistics surrounding this topic to find out a bit more. National Nutrition and Physical Activity Survey conducted through 2011 to 2012 by the Australian Bureau of Statistics found we are consuming 30% less fruit and vegetables than 15 years ago. 1 in 4 adults eating no vegetables on an average day, and only 7% eating the daily recommended 5 servings. According to WIN in 2009, young people are the healthiest group of the population in Australia. But listen to these shocking statistics about those kids. Adolescent students in years 6, 8 and 10 were surveyed on their food habits in 2004 as part of the New South Wales Schools Physical Activity and Nutrition Survey. It was found that 25 to 30% ate confectionery at least 4 times a week, and approximately 55% of boys and 40% of girls reported drinking at least 2 quantities of 500 ml of soft drink every day. The survey also found that 1/3 of young people did not eat breakfast every day, and 1 in 5 students eat potato chips at least 4 times per week. So the determinants that relate to healthy eating are economical determinants, so the cost of food greatly influences how people buy certain foods. It's been found that nutritious food is 30% more expensive in rural and remote areas. Income is another factor, so if people are on a strict budget, they're obviously not going to be able to afford to purchase some of the healthier foods out there. And transport can also be an issue. So do people have the transport readily available to go to the supermarkets to get the fresh food? Okay, so there's social determinants. Where food is eaten can influence the types of foods that are consumed. So healthy foods might not be available at shopping centres, which leaves people with not much choice, and they'll end up having to buy the unhealthy food anyway. Cultural and family differences in food choices mean that people have been brought up eating certain foods, and this can sometimes mean the exclusion of certain food groups like meat or dairy. Meal patterns, so is it normal to snack throughout the day, or should you have 3 main meals? Many people experience the 3 o'clock munchies and they want a hot chocolate hit or a sugar hit. So when people get to this stage, their choices may be influenced by what is available and what they have previously eaten that day. The biological determinants is one of the main ones that relates to food choices and healthy eating. So in terms of hunger, a study conducted by Stubbs, Van Wyk and Johnson and Harborn in 1996 found that when we eat fatty foods, our hunger is not satisfied. Carbohydrates has an intermediate effect, and protein has found to be the most filling. Palatability is also a factor. So if sweet and high-fat foods have a large sensory appeal, which is why we consume so much of these foods. And taste. Obviously, we all want something that tastes good. Certain people are born with likings and dislikings, such as salty and bitter. The psychological and behavioural or physical determinants. So stress can be found to influence the food choices we make. So people might eat less food when they're experiencing psychological stress, or may have a preference for a type of food. Mood also has an influence on our food choices, so food cravings, diets, and body image, which results in specific food choices. Okay, so education. So if people don't have education about the food and nutrition that they're having, then they're not going to make very good choices. If they don't have the skills to make the food, they're also going to make poor choices, or they'll think that they're going to get it wrong, so they won't want to try it. And a lot of people consider themselves to be time poor. So the curriculum, how does food, nutrition, and healthy eating link with the curriculum? So for the foundation level, contributing to healthy and active communities, and they need to identify actions that promote health, safety, and well-being, and there's an elaboration there as well. For levels 1 and 2, being healthy, safe, and active, so recognising situations and opportunities to promote health and safety well-being. Communicating and interacting for health and well-being, so examining health messages, and also being able to identify popular health slogans and health messages, sharing that with the class, and contributing to healthy and active communities, so exploring actions that make the classroom a healthy, safe and active place. For levels 3 and 4, being healthy, safe and active again pops up with identifying and practicing strategies to promote health, safety and well-being, communicating and interacting for health and well-being, so discussing and interpreting health information and messages in the media, accessing different sources of information as well, and contributing to healthy and active communities, so describe strategies to make the classroom and playground healthy, safe and active. And for 5/6s, we've got plan and practice strategies to promote health, safety and well-being, so comparing food labels and also investigating the role of preventative health in promoting and maintaining health, safety and well-being. For levels 3, 4 and also 5/6, we've also got some links to technology, so investigating food and fibre production and food technologies, and also investigating the role of food preparation in maintaining good health and the importance of food safety and hygiene. So research into the teaching and learning regarding food and nutrition. So according to the World Health Organization, health education improves the health status of individuals, families, communities, states and the nation, enhancing the quality of life for all people and reduces premature deaths. So in order to teach healthy eating as well as health education, we need students to gain knowledge and understanding surrounding these issues. According to Calcott, Miller and Wilson-Gahan, in 2009, schools are felt to be a perfect setting for capturing the attention of the young in relation to their health and well-being knowledge. They also stated that schools facilitate the learning of health, knowledge, understanding and skills that will empower students to choose positive behaviours for their health and well-being. So it's essential that students are educated on and have access to health information. St. Leger in 2006 suggests that in order for health education in schools to be effective, we need between 40 to 50 hours per year of dedicated health teaching. So that means that we can teach protective factors to the students such as coping, decision making and health literacy. Jordan et al. In 2000, cited by Lee, McQuaig, Burrows, Penny and Wright in 2015, suggests that maximising a country's health literacy is now seen to be one of the most important approaches to improving population health. Okay, so what are the don'ts when it comes to health education? Wright in 2014 suggests that students rarely respond to being told what to do, how to behave, or even being shocked or scared into making healthy decisions. Scare tactics are not effective and don't actually educate students, they're merely there for impact. Further adding to this, Tones in 1993, as cited in Lee et al. 2015, page 137, states that an emerging perspective in health education is that people should be involved and consulted rather than subjected to coercion. Some other notions that are not effective when it comes to health education are one-off sessions or programs that are driven by outside organisations. One-off sessions are not ongoing and don't involve the student in continuous and consistent education, which is what health education needs to be. Outside organisations are similar, with most coming to the schools for a day visit. Again, this is proven to be ineffective and doesn't teach the students what they need to know. If we know that these things don't work, then how should we be implementing health education in schools? It's widely known and accepted that health education needs to encompass the whole school, otherwise known as the Health Promoting Schools Framework. This framework works with all dimensions of the school community to ensure a holistic approach to education is embedded in schools. O'Day, in 2010, discusses how school-based education programs may provide an efficient and effective way to approach health education problems. By utilising a health promoting schools framework, a suitable approach is offered because it encompasses a range of influences to the school environment. O'Day in 2010 also suggests that based on research, educators need to teach preventative strategies which encompass objectives of whole health promotion, including healthy eating, improved body image, increased physical activity, as well as prevention of obesity. Learner-centered approaches are effective when teaching health education as they allow students to be active, construct their own knowledge, and it also builds on student prior knowledge and cognitive skills, as suggested by Lee et al. 2015. It means that educators can move away from being the source of information to being a facilitator that allows students to investigate and discover information for themselves. Wright, in 2014, suggests that a strengths-based approach to teaching health is also an effective tool. By working with individuals, families, groups, organisations and communities, this approach enables multiple environments to be recognised and also utilises the strengths of individuals rather than their limits. So my resource related to healthy eating is the Crunch and Sip resource program that's created by the New South Wales Government and is being implemented across a range of schools. So what is Crunch and Sip? The program has been running in New South Wales primary schools since 2008 and it gets students eating fruit and vegetables and drinking water whilst at school, as suggested by Healthy Kids 2010. The school chooses when they would like to take their Crunch and Sip break, which is when students are able to eat their healthy snack and refuel for the rest of the day. So these are some of the foods that are allowed. So fruit and vegetables and water and tin fruit in water or juice. Not allowed are the usual suspects, so hot potato chips, fruit pies, flavoured fizzy drinks, fruit cordials and all the other ones as you can see there. So the critique, the Crunch and Snip program is a school-wide initiative that has been developed to increase healthy snacks eaten at schools. As suggested by the Crunch and Sip program, the goal is to have the entire school participating, Healthy Kids 2010. This relates to a health promoting schools framework as the program attempts to provide a healthier environment and improve the health of pupils through eating nutritious food. The policy discusses providing information to parents so that they continue the health promotion messages at home, understand the role that they play in terms of supplying food and knowing what sort of foods are allowed. As suggested by Story, Nanny and Swartz 2009, schools can help in the fight against obesity by creating environments conducive to the healthful eating and physical activity, which is exactly what the program does. In regards to student-centered approaches, the students are the ones that are participating in the program each day, although the program was not something that the students came up with themselves as this is a government initiative. The program does link to the curriculum as students are eating the Always Foods and Drinks or the green food and drinks. They are exploring how fruit and water breaks help support classroom health and well-being and exploring how healthy foods can influence health and well-being as suggested by Akara 2015. The dimensions of health are where the program is lacking. The social determinant of health, which encompasses culture, family and meal patterns, is not catered for quite as well as it could be. So some families might not include fruit and vegetables as regular snacks, so this might be a little bit out of the way for them to do this. Economical determinant is also a problem because some families are struggling for money and they don't have the money spared aside for them to purchase fruit and vegetables for their children each week. The result of this means that some students might not have a healthy snack and left feeling embarrassed and a bit left out while the other kids are having their snack. The program does suggest a way to overcome this issue by stating that schools can source produce through donations from the local greengrocer. However, the program also suggests getting monetary donations from parents so that the school can purchase food for students. Again, this is just not viable for some families. The behavioural and physical determinant of health is also not really considered in the program. The program's not based on educating students, it's mainly just about getting them to eat a healthy snack at school. So part of the program is the students watch the Crunch and Snip and Sip DVD at the whole school assembly to show them what it's about, but that's basically where the education part ends. The ideas haven't been suggested to follow through into teaching healthy eating in the schools or to encourage teachers to incorporate healthy eating into their curriculum. The only mention of classroom learning is use Crunch and Sip as a tool for learning in your classroom every day. This is quite broad and the program doesn't offer anything beyond this statement. Overall, the Crunch and Sip program has some definite health benefits that have been outlined, but there are still ways which it can be improved to become a whole school educational focus. So here's the reference list. And thanks for listening.